civil and political rights are only half of the human rights picture. In addition to these civil and political rights, there are economic, social and cultural rights, including the right to the highest attainable standard of health, which is a shorthand I'm going to refer to as the right to health. All these rights are interrelated, indivisible and interdependent, and they all have equal status. The right to health is subject to progressive realization. The right requires access to clinics and hospitals and effective public health programs and so on. But of course, these can't be established overnight. They take time. Moreover, even when they are in place, they need constant care and attention to keep abreast of changing contexts. Government has to take all reasonable measures at its disposal to optimize the health of all individuals, communities and populations, with particular attention to the disadvantaged. Human rights have been negotiated and agreed by governments. They've been affirmed by the United Nations. They are a universal code of conduct for governments and those holding power. They embody a set of values, so why not use them explicitly? Human rights can be insurrectional, as they were in apartheid South Africa. But human rights can be judicial. That is the basis for court cases and judicial decisions. They can be inspirational, inspiring campaigns to create a fairer society. And they can be operational. That is, integrated into law, policy and practice and implemented on the ground in reality. About 10 years ago, the UN Secretary General, Kofi Annan, flew from New York to Geneva, and he addressed, and it was an important human rights speech, he spoke to the UN Commission on Human Rights. And he said to the government sitting there, he said that we have moved from the era of declaration, that was his phrase, we've moved from the era of declaration, and that's now giving way, he said, to a, and I quote, era of implementation. Implementation doesn't mean passing a law or writing a new health policy, although laws and policies are really important. Human rights implementation means making human rights real for all, in practice, in clinics, in hospitals, in communities, in care homes, and so on. Specificity helps when it comes to operationalization. There are two ways to do this operational specificity. One way is by the government deciding one or two priority national themes as vehicles for a human rights-based approach. So they might be mental health or child obesity or whatever jives in the national context. That's one way of doing it, national themes, focusing on that specificity. Another way is by the government inviting its territorial areas to choose one or two themes that are doable in those territories. In the era of implementation, health professionals have to be persuaded to adopt a human rights-based approach to health. In addition to the legal and moral arguments in favor of a new intervention or a new policy or a new approach, health professionals, it's in my experience, often also want evidence that the new intervention or the new approach will save lives and reduce suffering. They want evidence that a human rights shaped intervention will help them deliver their professional objectives. Mixed methods and multidisciplinary approaches are necessary in order to capture the evidence of impact of human rights on health. Evidence of impact of human rights is a very new field of research. Frankly, we are still feeling our way in methodological terms. And it would be wonderful if some Scottish experiences contributed to this new field of study. Human rights in health are really important, but they're not rocket science. And you are doing most of this stuff already. But I encourage you, that's you, leader, I encourage you to think about the further application of human rights in your communities, in your hospitals and clinics and so on. And I don't want a tick box compliance exercise, although that does have a role. And I don't expect you to roll out comprehensively and perfectly a human rights-based approach. Human rights will always be work in progress underpinned by legal obligation. But I encourage you to take human rights seriously and explicitly and thoughtfully. Don't expect anyone to tell you how to do it. I invite you and your colleagues with some light touch human rights guidance, as well as input from civil society, to think how human rights might assist you in some of your work. Don't overcomplicate it. It's clear that the government takes human rights seriously, for which it deserves great credit. Recently, the First Minister has given the green light for work on health rights specifically, and I have the impression that Scotland has a significant contribution to make in this growing international movement towards the operationalization of human rights in health, so they make a difference in real life, in communities and homes and workplaces and clinics and hospitals and elsewhere.
Let's do emergency departments was the genius idea of the Human Rights Commission, and so we ran a national inquiry, as it's known in the human rights world. The Human Rights Inquiry tried to connect the dots. We had public hearings all over Northern Ireland, and we were looking to hear from the public and providers and policymakers, those who commission services, what all of their experiences were like. When we worked with the clinicians, the consultants, the nurses on the ward, the social workers, what we realised was we were able to weave it right in. We didn't reinvent the wheel. It's not, as Paul said earlier by reports, rocket science. One of the things that came out was we do human rights. These values are at the heart. Dignity, respect, you know, you're preaching to the choir, and in fact we sing better than you do. What is it that you are bringing us? The key, I think, whenever you go into any particular setting is people have their own language and their own values, and they don't need you to come in and reinvent them. Their language first. And all we did was elaborate. So when that says that in your standards, there is the piece from the Human Rights Act that relates to. The idea is to enrich the language that people already have with practical examples, but they have to be hardcore. They have to be a mix of human and also hardcore law. I'm never going to convince anybody. We're making a video at the minute, and we're going to do it with the lead nurse in the ED department in Belfast, because who are people going to listen to within an emergency department? They don't know me from Adam. They're going to listen to somebody that have some respect for, who they know have done the hard yards and understands the problems they face day to day. We develop the scenarios that are plausible for the people that we're working with, and then we work through the rights. And the good thing about this process is it's plausible at the start because it's their own stories. And hopefully it's plausible at the end because there should be one of two things. Sometimes the decision or the process could have been different and kept them the right side of the law and a more comfortable position for the staff. Sometimes what they did was right, even though everybody kicked off about it. And that's a really important part of a human rights-based approach story. These are very challenging situations, and part of what we have to do is when it was right, we have to endorse it, and stand by our colleagues and say, that was right. I know they kicked off. I know the family didn't like it, but you were right. For example, the man with very extreme arthritis, he had to wait 10 hours on a trolley. And within emergency departments, the battering that had come from the media, the expectation was, all right, trolley wait, trolley wait. The story with that man was not really the 10-hour trolley wait. The story was the fact that his wife, within those 10 hours, had to make a pillow for him out of a towel and her coat. And this is where human rights comes in, because it says you have competing demands. It may well be that night that the best use of the resources meant that the man had to wait for 10 hours. Nobody wanted him to wait for 10 hours, but he didn't have to wait 10 hours without a pillow. And waiting 10 hours without a pillow, let's go to the hard law, that's inhuman and degrading. So the challenge with emergency departments in particular was to say, very often, your difficult decision making, your balancing of competing needs is spot on, but other things get lost in that process. The new bit is we create a human rights frame, because you can't just have everything you want. The health service has to operate within the law, and it's important for people to know that hard decisions have to be made. The thing that really tickles the health and social care sector when I speak to them is when I talk about sustainability. The right to health, which Paul explains far more eloquently than I ever could, fundamentally depends upon, yes, you have to create available services and they have to be accessible and they have to be non-discriminatory and they have to be of a good quality, but it has to be a sustainable health service overall in order to satisfy the right to health. And that means somebody has to make hard decisions. So much depends on the accountability mechanisms, the policies at the very start, and the purse holders in all of this process, and they can't be left out. Policies need to ensure that human rights are protected, but they also need to give staff the room to make decisions based on the individual need at the time.
In a modern developed democracy such as Scotland, this is inevitably where the biggest policy and delivery challenges remain. And SNAP has identified that many of those challenges are located in the health context. And for many people, many citizens, the place where they are first led to question and the extent to which their human rights are being respected or the human rights of their loved ones are being respected is in a health context. Many of the things that people were talking about wanting to experience in their engagement with the system are not things which have a price tag attached to them and are about the way that every single one of us as public servants shows up in our jobs and in the relationships that we have with people. I see the biggest challenge for the Scottish Government and other public authorities in Scotland now as ensuring that a human rights-based approach can directly support our policy making.
Our approach to human rights and health is described as a work in progress, and so it is. But let's not forget that that progress is underpinned by a number of important legal obligations. This is not something that is optional. This is not something that we can do if we feel we have time. This is absolutely fundamental to the delivery of respectful and person-centred care.